Is there any role for any type of imaging, like a CT, or is there anything like that anatomically that you can point to?
I don't ever really order a head scan unless I'm thinking it's say a seizure disorder or a tumor that's really not very common for ADHD students, kids. I really just go clinical. Now, if they're displaying weight changes too much, being real tired in the day all the time, or something like that, then I may look toward a scan. But it really needs to be a valid reason why I'm going to get one, because they're pretty expensive, and I'm not sure what they're going to show me.
Then tell me some more about the neuropsychological testing.
Right. I will only order a neuropsychological test if I think a child may have a learning disability, and which is comorbid with ADHD in some cases. For example, spatial relationships. The mom may say, my child have problems with putting their toys in the toy box, are very clumsy, falling down. I keep getting the left and the right confused. And that's pretty hard data. I can say, let's look at something else here. It may not just be an attention thing. It could be a problem with spatial orientation, or a problem encoding information correctly and letting you know they have it. Some kids are very, very, very smart, but they cannot answer, say, a spontaneous question. They have to think about it for a while. That's not necessarily ADHD. They just may have an encoding deficit that can be treated with certain type of different modalities.
Now, what are the classic symptoms that you're looking for in terms of the inattention?
Really, when parents say they just spacing out. That's really the number one thing for the ADHD. For the hyperactivity part, I'm looking for parents to say, my child acts like he has a motor turn on. That inner restlessness, keep moving, which is age inappropriate. Because, 5 years old always move a lot, but it has to be age inappropriate. A 9-year-old should be able to sit down in the classroom for an hour or two straight and get up and take a break without jumping up and walking around. So it has to be age inappropriate behavior.
And what about their ability to follow through on task or organize? Is that impaired?
Oh yes, a lot of kids with the ADHD, with the inattentive part, often loses their assignments, even loses their pencils, or put books under their desk, and they're going so fast they may pull out the wrong book and definitely turn to the wrong page. And they're actually trying, they just really can't keep up. And the teacher's going on with the work, and they sort of lost, and they're too embarrassed to speak up, because they don't want other kids to laugh at them. So they just sit there and actually compound the problem. And then they get home and too embarrassed to tell the parents sometimes. And it comes out with a note from the teacher on report card day.
What does it come out that the child is, they might not think they're bright or they can't do the work. Really they can, but they just...
Right. I see it both ways. I see that sometimes the teachers may say or imply that the child is slow when the child is not slow. And the kids come back and say, ask their mom and dad, Mom, am I slow, am I special? It's just not catching up because they're not encoding information right. Those same kids under medication or therapy can do very well. It's equal as they say the top one in the class. As high as the educational and IQ allow them to go, they can do that, they can excel.
What would be some examples that you look for in terms of impulsive behavior?
Blurting out answers, not staying in line, just walking out, really walking out the line, and not really to achieving a goal, not to go and see a friend on the end of the hall, just walking straight line, just jumping out, just jumping back in. It's almost like something that's turned on, almost like they're dancing to a different beat. They just can't hold it together. And if you try to calm them and retain them, sometimes you can make them worse if it's not done in a loving manner. So I tell parents, if they get out of control and get too impulsive and say, sometimes they may push back and won't hit, just tell them you're calming them down for a while. You don't need to squeeze them, just kind of hold them a little bit and they'll be okay, especially when they're really young.
What about the hyperactivity kind of motor manifestations? What are they?
Oh, these kids, actually, they're not very hard to diagnose because they come in, they may get in the chair, stand up in my chair, say, no, sit down, sit down. They get back in the chair again, they come around behind me, I get a little nervous in my office. So when I start getting nervous, this person has ADHD or something, they come all around and they want to go get all the books off the shelf. They just really have a difficulty sitting still. even for a few minutes, even when I tell them, try to sit still. What I like to do is just tell them to bring a tape in and look at a show at home. Can they see say a 20 or 30-minute TV show? Some kids can suppress their symptoms for a while, but still not long enough to get through a show that they like. So it's always important to find a show that they like, and then I want to watch it with them, look at a tape with them, part of it, and they still move through the tape. Interestingly, though, they can focus and remember some of the things that they like. So it's sort of selective in some ways, but they can't remember the details of the whole show.
Now, what's the natural course of the natural history of the disorder?
About a third of the students with kids with ADHD completely grow out of it in adulthood. About a third keep the full-blown symptoms, and another third have mild symptoms. So about 60% have symptoms into adulthood, which makes it's a pretty big deal. It turns into about 4% of the population, or 8 million adults that have ADHD now.
So that